Health is brought to you in part by Intermountain Healthcare and the Utah Department of Health.
Men are notorious for toughing it out and pushing through all sorts of aches and pains, but there are some things that should not be ignored. And we have Brett Mackiff here from the Utah Department of Health. So how do we stay on top of our health?
Well, first thing we need to do is realize that we're not invincible.
Mm-hmm.
I know,
it's
it's a
hard
hard thing to believe. But when you think about over half of men haven't been to see a primary care provider in the last year. It's kind of a surprise.
Okay, so at what age should you have an annual exam?
Well, it really depends on your own health, but it's a good idea to get in there on a regular basis. You know, we recommend after age 40, people get in there,
Sure.
Just make sure things are running. We check our oil, we rotate the tires, so to speak. We need to do the same thing to ourselves.
Yeah, I certainly make a habit of getting to the doctor at least once a year. And I thought it was interesting here. You can live a healthy, long life, number one, if you don't do anything stupid. And two, if you stay on top of your health. I guess those are the two main things. But more specifically here, you got to be regularly physically active. That doesn't mean you have to spend 3 hours a day at the gym.
It just means you shouldn't save up all your activity and save it for the weekend. Do something on a regular basis so you keep up that level of fitness.
Eat a vegetable more than once a month, so French fries probably don't count.
French fries don't count. But we say, there's a lot of things that you can do to make vegetables and fruits more appealing. Try something out. Make your significant other happier.
Okay, and we already talked about seeing your doctor regularly, and also talk to your physician and family. Guys sometimes have a tendency just to bottle it up.
We're really good at it. And so don't clam up. If you're having issues, you want to be able to talk. Be willing to find somebody you're safe to talk to. Be willing to talk to your healthcare provider as well. It makes a big difference. When we look at the issues that stand out for what we see with men, mental health becomes a very, very powerful thing. We also look at heart disease and stroke prevention. Diabetes is a very strong impact in our Utah society, and we want to make sure we can at least be ready to know if we have it or not.
So high incidence of diabetes in Utah.
We do have a lot of diabetes, more than we would like, and more than we actually know that we have. There's a good proportion of the population
don't even know.
Exactly.
Yeah. All right.
And so getting in and getting a good check to run that exam will save you a lot of pain in the future.
All right. Well, let's use this month, Men's Health Month, to turn over a new leaf.
Absolutely.
All right, Brett. Thanks a lot.
Thank you.